It's a new measure being put in place to hopefully get a better idea of how COVID-19 is spreading. The province of Ontario has changed their rules around who can be tested, but is still far away from reaching their goal of testing 13,000 people a day.
Yesterday, I spoke about new testing criteria. In addition to now allowing testing of some asymptomatic residents and staff in long term care and retirement homes experiencing an outbreak, the province added a list of less common COVID-19 symptoms to the testing criteria, especially for older adults and younger children who may have atypical symptoms like nausea or vomiting or diarrhea. And the province again last night increased the categories of people eligible for testing.
The announcement comes at the same time Ontario reports 564 new cases of COVID-19 and 55 new deaths, the highest jump reported in a day. With even more people being tested now, Ottawa's Medical Officer of Health, Vera Etches, says we should have a better idea of how the virus is spreading in the city.
So these expanded criteria will allow us to test more people and get a better sense of the potential scope of infection in our community. And this is important into the future as we continue to look for more targeted strategies and the eventual relaxation of restrictions.
It's still far off, but Etches wants to know what restrictions should be lifted first when it's safe to do so. She said she's hearing from people that they want to have the opportunity to do more outside, whether that's playing soccer in the park or grandparents having the opportunity to see their grandchildren. As of right now, city parks and facilities will be closed until at least June 30th, but some are hoping restrictions will start to be lifted around the May long weekend. Back at hospitals with more people needing ventilators, concern is growing for capacity. At this point, there is still enough room to sustain new cases, but with the number of deaths growing, so are fears. Ottawa's first care clinic opened here at the former D'Aubry Moody Intermediate School last Monday. It's servicing patients who are experiencing respiratory issues, which really include any cold-like symptoms like a cough or fever. Ottawa's care centres have been relieving pressures in emergency rooms, said Dr. Andrew Wilmore, the medical director in emergency management for the Ottawa Hospital. Since opening, they have seen over 400 patients as of early this week, with the assessment centre at Brewer Arena testing over 7,300 people. Etches still encourages anyone to visit Ottawa hospitals if they feel they need to, but as care centres are available to those who are experiencing respiratory issues. But as Canada continues to implement new safety measures, the United States is trying to bring life back to business as usual. Yesterday, President Donald Trump said he was looking at opening up the Canada-US border, something Prime Minister Justin Trudeau doesn't support.
I think there was a recognition by the president, as I've highlighted many times, that the closeness, the collaboration, the friendship between Canada and the United States is quite unlike any other. And therefore, the work that we continue to do to keep our citizens safe while coordinating very carefully is unlike our approaches with other countries around the world. There's a recognition that as we move forward, there will be special thought given to this relationship. But at the same time, we know that there is a significant amount of time still before we can talk about loosening such restrictions.
This afternoon, it was announced the Canada-US border would remain closed for at least an additional 30 days. Prime Minister Justin Trudeau saying the government will not be rushing to open things back up, stressing the fact that their priority is keeping Canadians safe. Charlie Cenac, TWIN News, Ottawa.